Hello, my name is Abraham Peled. I'm a psychiatrist, and for many years I'm trying to promote reconceptualization of mental disorders as brain disorders. You can find my website, brainprofiler.online. In a previous video, I talked about consciousness in general. Now I will want to talk about consciousness in the context of mental disorders. So, which are the mental disorders that are related mostly to disturbance of consciousness? So we talked about consciousness being an emergent property, a whole brain organization, and an optimization of partial processes, multimodal processes into a unique, unified, instantaneous, serial process of optimal brain organization that allows us to perceive the reality in an organized and adaptable and functional way. Now, this is not something that is obvious, and we know from our patients that conscious organization, the optimal conscious organization, can be disturbed. For example, with hallucinations, perception without stimulus, brain activity is disconnected from the input, disconnected from other brain activity, for example, the auditory and the visual systems are disconnected, and the auditory and speech activity could be activated statistically independent from the rest of the networks. And then the experience would be hearing voices that don't exist. This could be one example of how we can explain a clinical phenomenological symptom into a disturbance of brain organization. Let's take another example. For example, if we assume that thoughts are activated, integrated, conscious processes, then by a collapse or breakdown or disconnection between the parts of the global organization can cause different thoughts to be disconnected from the other thoughts, meaning what we call a loosening of associations. The associations are disconnected from each other. So then we can get this phenomenology that we find in the clinic where the patient jumps from one concept to another, and this has various degrees. It could be a low degree where sentences are not connected, but it could be even a severe degree where words are not connected within the sentences, and then the content is lost. Also, by disconnecting associations, logic could be influenced. For example, if there is one association connected to the other, creating the logic, for example, an association that it's raining outside, another association that I go outside, the third one would be that I will get wet. But if I have loosening of associations, I might think that it is raining outside, I go outside, and I am not becoming wet. And that will create a disturbance of logic. And the disturbance of logic can create a false thought about reality, a false, incorrect experience or thought about what is going to happen and what is happening around you. Now, false ideation brings us to delusions. False unshakable beliefs are actually a result of disturbance of logic that can come with associations, and this causes a breakdown in this phenomenology of an optimal, adaptable, logical, and unified experience. So here we are approaching the understanding that the etiology of psychosis would be a breakdown of global networks in the brain, a statistically independent breakdown of elements. And if we think about this connection, we can also think about an opposite disturbance like overconnectivity. When there is overconnectivity, the networks in the brain act as a crystal. They fixate. Each one has an increased activity, connectivity, constraining the other connections to be fixed and immobile and reduced. So the whole brain dynamics is reduced. The number of states that the brain can assume is reduced. And this reduction has an effect on the cognitive activity, creating what we find in the clinic as dementia precox. And the phenomenology is also explainable by overconnectivity, where you have different networks reactivate themselves. So you have these perseverations that you find in negative symptom schizophrenia. The number of states that the brain can assume is reduced, and this reduction gives you poverty of thought and poverty of speech, and other high mental functions like emotions and experience could be wiped out, and you get this dementia precox with avolition and dementia, actually. So now we can begin and see that psychosis and negative symptoms, what we call schizophrenia, could be actually a dynamic over time where you have disconnection initially. The brain tries to correct the activity and goes into an overconnectivity disturbance, and then it tries to correct again, so it goes back to a disconnection, it overshoots. So this overshoot between disconnectivity and overconnectivity can explain the phenomenology over time of this terrible disease that we call schizophrenia. Now, in the past we used to talk in very general sense, like disconnection and overconnection. Today we are more advanced. We know that the optimal brain assumes an organization which is called small world network. Small world network means that there is optimal information transfer in the brain, which characterize a network where you have a cluster of dense nearby connections and a few faraway connections. There is a balance between the clustering connectivity and the long path connectivity. And this optimal organization is characterizing networks, internet, social networks, train tracks, airplane routes, and so on. And also the dispersion of epidemics make it very easy to information to spread all over, and in the brain it makes it easy to the brain to integrate experience. So a small world network organization, it's also called small world because of these famous experiments where you have many people that can connect with, among themselves, and you need only 6 steps of separation in order to move from one part of a network to the other part of the network, and it is reflecting the efficiency of such networks. So we know that the optimal network for people like those who do not have any disturbance of consciousness or mental disorders assume a small world network organization. Now, if this small world network organization, let's say the nearby connections are disturbed, the system becomes unpredictable, unstable, disconnected. So you have this disconnection dynamics. And when the opposite happens, you have many long path connections and a few nearby connections, and the system would go into a crystal freezing state where you have overconnectivity. So today, we could already begin and change the terminology. Instead of saying psychosis, this patient is suffering from psychosis, we can say this patient is suffering from a disconnection dynamics in the cortex. That would be etiology, a place in the body, the cortex, and disconnection syndrome is the pathology. Okay, when you say psychosis, when you say depression, anxiety, and so on, there are not locations in the body, and there are not any pathology. So we can now move from a term which is not brain-related, like psychosis or dementia or negative symptoms, into a brain-related etiological description, which is disconnection syndrome, overconnection syndrome, and take it another step forward and say this is a disturbance of small world network organization in the sense that it becomes unstable and disconnected. So it's just like an arrhythmia, cardiac arrhythmia, brain arrhythmia. That's nice because it brings us closer to etiology. So register to my channel. You can join my website at brainprofiler.online, and see you next video.